Welcome to E3 Rehab. I'm Dr. Mark Sertica, physical therapist, and today, with the help of Dr. Nicole Sertica, we're gonna bust the myth that seated leg extensions are dangerous for the anterior cruciate ligament after surgical reconstruction. Let's start by looking at the anatomy and function of the ACL. So it attaches from the medial aspect of the lateral femoral condyle to the anterior intercondylar area of the tibial plateau. It primarily resists excessive anterior translation of the tibia on the femur, which is mainly what we're looking at today, as well as resists varus, valgus, and axial rotation forces.
After an ACL reconstruction, some of the first activities that you'll be doing are things like walking and squatting. Now, when you walk, the peak anterior shear force of the tibia on the femur is going to be about 355 newtons at 16.8 degrees of knee flexion. When we squat, there's about a 3.6% strain on the ACL. Now, right after surgery, the surgeon will do what's called the Lachman test to your knee. The Lachman test causes about a 3.5% strain on the ACL when done with about 150 newtons of force at 30 degrees of knee flexion. Now, if we compare that to the seated leg extension exercise, that causes a 2.8% strain on the ACL, and the peak anterior shear force is 248 newtons at 14 degrees of knee flexion. Let's put both of those up on the screen to show a comparison. As you can see, the force and strain being placed on the ACL during that active knee flexion extension movement or the seated leg extension exercise is really similar to the forces and strains placed on your ACL during walking, squatting, and the Lachman test. Granted, those amounts of strain and forces on the ACL during the seated leg extension exercise are unloaded, but even when we add 10 pounds of resistance, there's still only a 3.8% strain on the ACL. Furthermore, we're not likely to load up an exercise after a surgery anyway, and instead we should be taking more of a gradual progressive loading approach with any exercise that we prescribe. The ultimate strength of the native ACL is about 2,000 newtons. Now, none of the exercises that we perform in the rehab program, whether they're open kinetic chain or closed kinetic chain, come anywhere close to that amount of force. So really, they're all pretty safe. Recent systematic reviews also show us that there's no difference in anterior knee laxity between groups of patients who do open kinetic chain exercises versus groups who do closed kinetic chain exercises. So since there's no difference in laxity between the two groups, there's no reason for us not to include them in the rehab program. And there are a whole host of reasons as to why we should include them. In the next two videos, we'll discuss why it's so important to load the quads with open kinetic chain exercises, and we'll go through how you can go about that with a graded approach for patients who have just had ACL reconstruction.
All right, thanks for watching. Make sure that you hit that like button, subscribe. You can also check out Nicole's YouTube channel and her blog on this topic by going to the links in the description. You can also head over to e3rehab.com to check out more of our free content and some of our programs. Also be on the lookout for those two other videos that are going to discuss how and why you should be incorporating the seated leg extension after an ACL reconstruction. Peace.